Good day, class! I am Sharina Maika Bisa Cruz. You can call me Teacher Maika, and I will be your teacher in this subject, Health 9. Okay, I can see that everyone is present today, so let's proceed. So for today's lesson, we will talk about the common and intentional injuries, and my dearest student, you are expected to identify common and intentional injuries in school. Number 2, demonstrate proper first aid procedures for common and intentional injuries. And lastly, reflect and understand the importance of being a first aider. So class, before we proceed to our lesson, we will have a short activity. So this activity is what we call quiz and double match. So direction. Arrange the jumbled letters in column A to form where they belong, then connect them to the statement in column B. So do this in 1/2 sheet of paper. So, are you ready, class? So, time starts now. Time's up, class. So, number 1. What is it? So, yes, it is bleeding. So, bleeding is the loss of blood. So, number 2 is strain. So, number 2 is, it occurs when a muscle is stretched beyond its normal range motion, resulting in a tear. So, number 3. Yes, fracture. Fracture is a break or crack in the bone. So number 4 is sprain. Sprain is an injury to the ligaments due to violent stretching or twisting. And lastly is poisoning. So poisoning is, it occurs when swallowing substances. Very good. So class, before we start our discussion, we will have a short activity. So this activity will help us know how knowledgeable you are on giving first aid. I will show you a picture of an injury and then tell me what kind of injury it is and what immediate action must be done. So number 1 picture. Yes. Yeah. A person hit by a car in the middle of the road. Very good. So what first aid will be given? Secure the victim, immobilize the victim into safer area before applying first aid. So number 2. Yes. You are bleeding due to a big wound on the forehead. Good. So, stop the bleeding. Number 3. Yes. Somebody fell from the stairs and was unconsciousness. So, give a glass of water or check vital signs and possible fracture. And number 4. A person had an amputated finger, so stop the bleeding and call for medical help. And lastly, last picture. Okay, you accidentally touch a hot iron and burn your hand. So, pour cold water. So those concepts you have guessed were related to our topic today. But before that, let's unlock first the difficulties you will encounter in our discussion through an activity. So let us have a matching type. In column A, you can find the words which are difficult to understand and their meanings in column B. So, let's start. Now, who can match the first word? Okay? Very good. So, sprain is a injury to the ligaments due to violent stretching or twisting. Strain is what? It occurs when a muscle is stretched beyond its normal range of motion. Very good. And fracture is, okay, it is a break or crack in the bone. Number 4 is burns. It is classified based on the depth of penetration on the skin, namely first degree, second degree, and third degree burns. And lastly, bleeding is external and internal bleeding are two types of this. Very good. Now, you have already understand all those different terms that you may encounter in our discussion. So, let's proceed. So, class, what do you know about unintentional injuries? Yes? Very good. So, unintentional injuries, it is an injury that is not caused on purpose or with intention to harm. Okay. So, very well said. So, what are the common unintentional injuries? Yes, fracture. Very good. Fracture is a break or crack in the bone. It can be simple, close, or compound, open. In close fracture, the skin is intact and no wound can be seen on inspection. While in open fracture, the damaged bone protrudes through the skin, resulting in a wound. So, what are the signs and symptoms when considering a fracture? Yes? Very good. So, these are the signs and symptoms when considering a fracture: deformity, swelling, limited movement, grating sensation, tenderness and pain, flash and warm skin. So, what are the first aid for fracture? So, number 1 is check distal pulses. Number 2, cut the clothing covering the injured area. Number 3, ask the victim to try to move the area distal to the fracture. Number 4, use the RICE procedure. So, A, rest, B, ice, C, compression, D, elevation, and number 5 is use a splint to immobilize the fracture. So, class, I will demonstrate the first aid for fracture. So, class, this is another common unintentional injury in the bone. So, what is dislocation? Yes? Very good. So, dislocation is a partial or complete displacement of the bone. So, this is the first aid for this location. So, number 1, Call for help immediately. 2. Splint the affected part. 3. Do not try to move a dislocated part or force it back into place. 4. Apply ice on the injured part to reduce swelling. So, another common unintentional injury are sprain and strain. First, let us discuss strain. Strain is an injury to the ligaments of the bone due to accidental tearing or overstretching. The skin of the injured area may be discolored because of the bleeding from torn tissues. While sprain is an injury to the muscle, which is result of improper use of muscle. So this is the first aid for strain and strain. So number 1 is rest injured part. 2. Apply ice. 3. Compress the injured part. 4. Elevate the injured part. So, I will demonstrate the first aid for strain and strain. So class, what is bleeding? Okay. So bleeding, it is the loss of blood. There are 2 types of bleeding. External bleeding and internal bleeding. So external bleeding occurs when blood can be seen coming from an open wound. While internal bleeding occurs when the skin remains intact and blood is not visible. So, this is the first aid for internal bleeding. So, number 1, monitor the victim's circulation, airway, and breathing. Number 2, elevate the legs and cover the victim with blanket to keep warm and prevent shock. 3, if vomiting, place the victim on his or her left side to prevent food getting into the lungs. And number 4, seek immediate medical attention. So this is the first aid for external bleeding. Number 1, protect yourself by wearing gloves. Number 2, place sterile dressing or clean cloth over the entire wound and apply direct pressure. Number 3, if the bleeding is from an arm or leg, elevate the injured limb above the level of the heart. Number 4, if the bleeding continues, apply pressure at any pressure point to slow the flow of blood. in combination with direct pressure over wound. Number 5, after the bleeding stops, use a pressure bandage to hold the dressing in a place. So class, what is burns? Excellent. So burns are often due to domestic incidents such as touching a hot iron, friction, or spilling boiling water on the skin. So burn injuries can be classified as number 1, thermal, contact with flame, hot objects, hot liquids, or steam. Number 2, chemical, contact with acid, alkali, and organic compounds. Number 3, electrical, exposure to electric current. Burns are classified based on the depth of penetration on the skin, namely, first degree burn, second degree burn, and third degree burn. So first degree burn affects the skin's outer layer, epidermis. Redness, mild swelling, tenderness, and pain. Heals without scarring, usually after 1 week. So, after 1 week, nai-heal naman siya. So, this is the first aid. Immerse the burnt area in cold water or apply wet cloth to relieve pain. Number 2, relieve pain and inflammation with analgesic ointment. Number 3, apply mild moisturizer to moisten the skin to prevent itching and peeling. So, the second degree burn extend into the inner skin layer, dermis. Blood vessels are damaged. Blisters, swelling, weeping of fluids, and severe pain. Breakout of blisters increases risk for infection. So the first aid is immerse the burnt area in the cold water or apply wet cloth to relieve pain. Number 2, relieve pain and inflammation with antibiotic ointment. Number 3, cover the area with sterile dressing or clean cloth. Number 4, elevate the burnt limb to reduce swelling. And lastly, the third degree burn penetrates all the skin layers into underlying fat and muscle. Glittery, waxy, or pearly gray skin. No feeling of pain due to destroyed blood cells and never endings. Requires medical care that involves removal of the dead tissues. So, di mo ma-feel yung pain. And the first aid, cover with dry non-sticky sterile dressing or a clean cloth. Prevent shock by elevating the legs and cover the victim with blanket to keep warm. So class, who among you has an idea about heat exhaustion? Yes? So heat exhaustion, it occurs when the body is not able to cool off and maintain a normal body temperature caused by either hot weather or dehydration. So, what are the signs and symptoms of heat exhaustion? Very good. So, signs and symptoms of heat exhaustion are dizziness, nausea, shallow breathing, excessive sweating, rapid heartbeat, and headache. So, what are the first aid for heat exhaustion? Number 1, transport a victim to a cooler place. Number 2, give him plenty of water. Number 3, check for vital signs. And number 4, seek medical help. So, I will demonstrate, class, on how to give first aid for heat exhaustion. So class, what is heat stroke? Okay, it is a critical stage of heat exhaustion where body reaches 40 degrees Celsius and above. So this is the first aid for heat stroke. Move the person immediately to a cool place. Remove as much of his outer clothing as possible. Call for medical help. Wrap the person in a cold, wet sheet and keep the sheet wet until his temperature drops to 38 degrees Celsius or 37.5 degrees Celsius under the tongue and armpit, respectively. Number 5, if the person returned to normal temperature, replace wet sheet with dry one. Number 6, monitor vital signs until help arrives. And lastly, number 7, if temperature rises, repeat the cooling process. So class, I will demonstrate the first aid for heat stroke. Class, what do you know about food poisoning? Yes? Very good. So, food poisoning is caused by consuming food or drink that is contaminated or viruses. So, this is the first aid for food poisoning. Number 1, help the person to lie down and rest. 2, give him plenty of flavorless fluids to drink and a bowl to use if he/she vomits. 3, call for medical help if the condition worsens. So what does choking is all about? Good. It occurs when a foreign object lodges in the throat or windpipe, blocking the flow of the air. So, this is the first aid for choking. Number 1, ask the person if he/she is choking. 2, encourage her to cough. 3, when the person cannot speak or stop coughing, give him a 5 back blows. 4, if back blows fail, try abdominal thrust. 5, check his mouth. 6, if obstruction still has not cleared, call for an ambulance and continue until help arrives. So how about drowning? Very good. So drowning happens when air cannot get into the lungs because of water. It can cause immediate death when taken for granted. So this is the first aid for drowning. Number 1, lay the person down on his back. Number 2, check breathing and open airway. 3, give rescue breaths and check compression if necessary. 4, if the person is breathing, place him in the recovery position. 5, treat for hypothermia by removing wet clothing and covering him with a dry blanket. So what does heart attack means? Okay, so heart attack is caused by a sudden obstruction of blood supply to the part of the heart muscles. So this is the first aid for heart attack. Number 1, help the person sit or lie down with the head elevated. 2, call for medical help. 3, if the person is conscious, give him a full dose aspirin and advise him to chew it slowly. 4, constantly monitor the vital signs. Be prepared to give rescue breaths and chest compression. So, yes, it's correct. So, now that you have understand our lesson, let's have a role play class. Are you ready, class? So now, let's divide the class into 3 groups. Count of 1 to 3 starting from this side. Okay? 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. So, all number 1, please stand up. Number 2, number 3. So, list down all your members and choose a leader. So, here is what you are going to do. Each group will be assigned a specific topic to demonstrate. You can do role play and you have to show how first aid is applied on specific injury assigned to you. The following are the rules to be observed while there is a demonstration going on. Number 1, group is given 5 minutes to practice and 2 minutes to perform your topic. Number 2, each group is expected to be quiet, to listen and observe while demonstration is going on. So group 1 will assign heat stroke and food poisoning. Group 2 is choking and heart attack. And number 3 is burns and drowning. So this is the rubrics. Presentation 40%, cooperation 15%, creativity 35%, total of 100%. So class starts now. Job well done, class. You have shown how first aid is applied on specific injury assigned to you. So class, please listen carefully because I will tell you a certain situation. So this is the situation. The child was trying to cross the street when suddenly he was hit by a car and a boy was found unconscious and not breathing. So class, what happened to the child? Yes, the child was hit by a car and got serious injuries. So class, what will you do if you witness this kind of situation? Very good. Considering calling 199, or if you know how to give first aid, then do it. So very good, class. So class, what have you realized in the importance of being a first aider? Very well said. So, it is important that you have the knowledge on how to give a first aid because you can save life. Also, through this, you can apply it in quickly responding to accidents to ensure that injuries can be efficiently and promptly dealt with before a trained medical profession arrives to administer more specialized treatment. Class, what have you learned in our discussion today? Yes. Very good. It is all about common unintentional injuries. So class, is there any question regarding our discussion today? Good. Get 1/4 sheet of paper and we will have a short quiz. So this is a quiz matching type. Match the injury presented in column A with the description information presented in column B. So write the letter of your answer. So are you ready, class? Okay, time starts now. Time's up, class. So, number 1, who can answer? Very good. So, it is a break or crack in the bone. It is D, fracture. So, number 2, it is an injury to the ligaments. It is what? Very good. It is sprain. Number 3, it occurs when the body is not able to cool off and maintain a normal body temperature. So, it is letter A, heat exhaustion. Number 4, it is a critical stage of heat exhaustion. It is what? It is letter C, heat stroke. Number 5, it is a common cause of accident to children. It is letter B, poisoning. So class, who got the perfect score? Very good. So class, this is my assignment to you. So essay, write it in a 1 full sheet of paper. So this is you will explain the importance of being a first aider. Thank you.